Welcome to today's Safety Daily Advisor webcast, brought to you by BLR and NPro Learning System. Today's program is titled Medical Treatment Case, How to Identify and Minimize OSHA Recordability. This is a 60-minute program. You may listen to the audio portion of the presentation through your phone line or your computer speakers, and you can sign on to the website and follow along as our speaker takes us through the materials. To view the materials, please go to beaconliveweb.com, enter the conference ID 6398, then enter your unique PIN, which was provided in the instructions you received. Finally, click Join Meeting. You will remain in a listen-only mode except when you are selected to ask a question. To join the question and answer session queue later in the program, simply press star 1 on your telephone keypad. I will announce you by your state prior to bringing you into the conference. To ask a question via the webcast, go to the chat pod located in the lower left corner of your computer screen. Type your question in the text box and then click on the Send Message button. You can submit your questions at any time during the webinar, and they will be addressed during the Q&A session at the end of the presentation. If you'd like to download a copy of the presentation materials, you may do so from the Handouts tab in the Conference Materials pod on the left side of your screen. Our guest speaker today is Jonathan Neubauer. Mr. Jonathan Neubauer, CSP, is a Regional EHS Manager for NPro Industries, Incorporated. After completion of a BS in Environmental Management and Technology, Jonathan began his career performing environmental remediation and consulting services for public and private clients across New York State. Jonathan first began working in the safety field in 2005 when he began to offer fall protection and rescue training and consulting services to several wind energy development companies across the globe. Our sponsor today is NPro Learning System. NPro Learning System is powered by individuals throughout NPro Industries, a diversified manufacturer of proprietary engineered products used in critical applications. Created in a multi-directional approach, the system provides resources for management commitment coupled with intensive employee engagement. Twice named America's Safety Company, NPro Industries has developed the gamut of best practices perfectly aligned to efficiently move an organization forward on the journey to zero injuries. Now, I'd like to turn the program over to Jonathan to begin our presentation.
Okay, thanks. Good afternoon, everybody, or maybe good morning if you're calling in from the West Coast. I guess to kind of start off a little bit further there on NPro Industries, you heard that we're a diversified manufacturing company, locations all over the globe, but we recognize that a very thorough understanding of the OSHA record-keeping regulations, the exceptions that apply, and a very intensive care management program are absolutely essential to the success of our safety program. And we're going to cover one of those aspects today, and that is really the determination of new cases, and also I'll share with you some systems and some programs that we have used internally to help us minimize our OSHA recordability. So to get started, we're going to jump right in with the definition of basically the basic requirements for determination of a new case. And I'm going to read the reg exactly as it's written out of 1904.7, letter A. And the basic requirement is you must consider an injury or illness to be work-related if an event or exposure in the work environment either caused or contributed to the resulting condition or significantly aggravated a pre-existing injury or illness. Work-relatedness is presumed for injuries and illnesses resulting from events or exposures in the work environment unless you meet one of the exceptions found in 1904.5b2. Now, right off the bat with this basic requirement, I have seen some of our internal companies as well as some customers that we work with stumble over some of the terminology written out right in the basic requirement. So before we go too much further, we're going to take some time to dive into some of those terms and make sure that we all have an understanding of what they mean and how they apply to OSHA record keeping. The four main areas we're going to focus on, first and foremost, what is an event or an exposure? Then we're going to talk a little bit about what is the work environment and how is that defined. We're going to talk about significant aggravation or significantly aggravated. And then we're going to also make sure we cover the exceptions to work-relatedness that are laid forth in the regulations. So to start off, we're going to cover what is an event or an exposure. And for those of you that haven't spent a great deal of time looking on OSHA's website, there's a wealth of information right at your fingertips through their website. And one of the resources they offer are letter of interpretations. And this next statement here is taken out of a letter of interpretation written on January 13, 2004, in response to several questions that were brought forward to OSHA. And again, I'm just going to read this verbatim, and then we can have a little discussion about what this exactly means. But in applying the presumption of work-relatedness, the question employers must answer is whether there is an identifiable event or exposure which occurred in the work environment which resulted in an injury or illness. And one of the areas where I think people stumble when it comes to an event or an exposure is if we don't see a direct cause of an injury or a very identifiable root cause, oftentimes we can think that this is not caused by the work environment, and therefore we do not need to record this particular injury on our injury logs. And an example of that is actually spelled out in this letter of interpretation. And in this example, there's an employee that is walking across a floor within the workplace. The floor is smooth, it is flat, it is free of any recognized hazards like puddles of water or cords, and yet the employee tripped and had an accident, an incident, which we're going to assume would meet the threshold of medical treatment or one of the other criteria for recording the case. So oftentimes where I see employers stumble on this particular topic is you do not see something that they had direct control of that caused or contributed to the accident. Again, they had a clean workplace, they had their programs all in place, they didn't have cords and wires or puddles of water on the floor, but yet there was still an event that happened and an injury that resulted. And if you were to follow the regulations when it comes to record keeping, an event or exposure has to only be one of the causes or contributing factors to an injury. And in this case, the act of walking is the event or the exposure, and the tripping in and of itself. The same could be said for walking up and down stairs. We all do that each and every day at our homes when we go out into the general public. But if it occurs in the workplace, if we're walking upstairs in the workplace and we sustain a knee injury or an ankle injury, some other injury, walking up those stairs and having that trip or fall event would tie in the work-relatedness to that particular injury. Now, if we breach the threshold for the criteria that would cause us to record this on our log, we would then have to make sure that we record it appropriately. And we will cover here in a few minutes what the requirements are for needing to record a workplace incident or illness. When we move on to the work environment, this is another area where I have seen some folks have some unclarity. And OSHA defines the work environment as the establishment or other locations where one or more employees are working or are present as a condition of their employment. This work environment includes not only physical locations, but also the equipment or materials used by the employee during the course of his or her work. And this can include some things like home offices. The work environment can include some areas that you might be in if you're traveling for business, such as conference spaces. It could include, outdoor environments as well as entertainment venues, if that is a place where your employees are as a condition of their employment. What you really need to look for when we're talking about work environment is, are they being compensated for things, from the employer? Are they doing work on the behalf of the employer when they have an injury? And the record-keeping requirements can get somewhat confusing, especially when we think about things like home offices or if you're on travel status. If we take a look at home offices, for instance, there are several hazards that may be in our home that actually, we may or may not come into contact with if we are simply working from our home office. But let's say, I work from home and my home office is pretty messy. I don't take the time to file away all my paperwork. I don't have my cords plugged in. hey, I got paperwork on the floor, and while I'm on a conference call, I'm pacing around the room and I slip on a paper and I sustain an injury. That would definitely be a work environment case under these regulations. That is definitely an area where OSHA would expect that we as an employer have trained our employees to keep their workplaces clean and free of any recognized hazards. Now, if they were doing something else in their home outside of their work duties, obviously that would not come into play. If they're, maybe they're preparing food, which is specifically exempt for themselves anyway, but if they're involved in something at the house that is not directly part of their work duties, chances are it would not be a work-related injury that would need to be recorded on the OSHA log. When it comes to traveling, there's some exceptions that are laid out in 1904.5b6, and for the most part, if you're traveling for business, again, if you're engaged in work activities in the interest of the employer, those items would be recordable. But let's say you've checked into your hotel room for the night and you decide to go out and run a couple of errands on your own, and you end up in a motor vehicle accident and sustain an injury that, again, reaches the criteria for recording. That would not be a work-related injury because, number one, we're doing something for personal reasons. We took a detour for personal reasons. And number two, there's an exception that if you've checked into a hotel for one or more days, you've essentially established your home away from home, and that provides you an exception from recording some injuries that take place after you have checked into that hotel room. Now, that would also provide you an exception if you end up in a motor vehicle accident commuting from your hotel to the job site. Those injuries would not be recorded on the log because, again, you're commuting from your home away from home. But if you're in that hotel room performing work in the interest of the employer, and again, we go back to that slip and fall injury we talked about in the home offices a moment ago, that would still be recordable even though you've established your home away from home. So you really need to do a thorough accident investigation, figure out what the employee was doing at the time of the incident, and really thoroughly read through the regulations and understand exactly what needs to be done. Another great resource that I didn't mention before is the OSHA record-keeping handbook that's available online. There's a lot of the letter of interpretations are already included in that handbook. It goes through several Q&A type of scenarios and really outlines a lot of the key requirements for record keeping. So I'd encourage you to look there as well for some resources on here. The last bullet there, entertainment venues, and I think this is an area that can get a little confusing to folks as well. If your company is essentially mandating that you as an employee show up and participate in an event, even if it's recreational in nature, and you sustain an injury, that very well could need to be recorded on your log. Voluntary participation in a recreational activity is specifically exempt, and we will talk about that in a moment. But if you were required to participate in this activity by your employer and there were an injury or an illness to arise out of that, it would definitely need to be recorded on your logs as well. Moving on to the next item of clarification, and that would be significant aggravation. And this is an area where I've seen people really struggle. Let's say this is going to come out of an article that's on EHS today. This is a specific example, but let's say you had an employee that went on vacation and they played a lot of tennis or golf on vacation. They sustained a tennis elbow or golfer's elbow injury. And we as an employer know about that, and we bring the person back to work. And while they're at work, they lift a 10-pound box or maybe a ream of paper or something along those lines, and their injury is now exacerbated. And it's exacerbated to the point where they need to go seek out medical treatment. This most likely would need to be recorded on our log, even though the underlying injury actually took place while the employee was on vacation. We still had an event or exposure in our workplace that caused significant aggravation. And you can see the definition here at the bottom of the slide. Basically, significant aggravation is where we have a case where we now need medical treatment, where no medical treatment was needed prior to, or perhaps there's a change in the medical treatment, and that was necessitated by the event or exposure in the workplace. So let's say that this person went on vacation, they developed their tennis elbow, they went to the doctor before returning to work, and they were given a prescription medication. Now they come into work and they exacerbate that injury by lifting the ream of paper that we talked about. and now the doctor actually is recommending days away from work to rest the elbow injury. That would be a significant aggravation of a workplace injury that would need to be recorded. Even though, again, the underlying event, the primary cause, was the activities on vacation, we still had an event that caused or contributed to the injury and caused it to require further medical treatment. So this is an area where I think oftentimes people fall back and they think, well, I know that he hurt his back while he was moving at home over the weekend and things like that. And we automatically assume that there's not a work-related aspect to the injury, but we really have to do a great job of, again, thorough investigation, determining what exactly took place in the work environment, and then, again, figure out what's happening on the medical side of things to determine if we need to record this on our logs or not. And you can, again, find some more information about this in 1904.5b4. But this is another really big area where I see some folks have some uncertainty and questions when it comes to record keeping. The last item that we're going to cover here on these definition side is the exceptions that we laid out in the second slide here. And these exceptions to record keeping can be found in 1904.5b2. I highly encourage you to read through these, really pay attention to what they mean and what they say, because these exceptions are afforded to us as employers to use, and we need to make sure that we're able to, we thoroughly understand what they mean, and that we implement them and use them whenever we can. We're not given many exceptions when it comes to record keeping. The presumption is that things are work-related. The work environment encompasses a lot of what we do. This really is one of the primary methods for us to keep things off of a log if we really understand what these exceptions are telling us. And they may seem somewhat common sense, but that's not always the case. I think you might need to deep dive a little bit more thoroughly and make sure that you have a good interpretation of them. But the first one that we're going to talk about is that at the time of the injury or the illness, the employee was present in the work environment, but as a member of the general public rather than as an employee. So depending on your business, maybe you have an employee that, if you're in retail perhaps, you have an employee that works for your store, but they come in as a regular shopper and they slip and fall. Obviously that would not go on your OSHA log as a work-related injury or illness. Just a brief example of where that might come into play. The second exemption would be the injury or illness involves signs or symptoms that surface at work but result solely from a non-work-related event or exposure that occurs outside of the work environment. So if we have somebody's personal medical condition flare up at work, but there is no event or exposure that is tied to that, perhaps somebody has a blood pressure disorder or something along those lines, and they're on medication for it. They forgot their medication, so the signs or symptoms arise at work, but we didn't have anything that was no event or exposure that contributed to that. That would not need to be recorded on your OSHA log. One we talked about just a moment ago, the voluntary participation in a wellness program, in a medical, fitness, or recreational activity, such as blood donation, physical examination, flu shots, exercise classes, so on and so forth. I know as an employer, we oftentimes hold blood drives at our facility. That's a great thing to do for the community, and every now and again you'll have somebody that loses consciousness during that blood donation. That would not be recordable due to this exception here in 1904.5b2. Now, let's say we had to have somebody give a blood sample for medical surveillance due to a contaminant they're exposed to or something along those lines, and they were to lose consciousness. That now would be a work-related injury if it took place in the work environment, as we discussed a moment ago. A loss of consciousness is an automatic recordable item on a log. So in that case, it would not be a recreational activity, but something that is required as a condition of their employment to have that medical screening. The next one, again, I touched base on this a couple moments ago briefly, eating, drinking, or preparing food for personal consumption in the workplace. Somebody goes and throws a thing of soup in the microwave, has it in there for a little too long, as they can pull it out, they get a burn. That would not be a work-related injury due to this exemption. Now, if the workplace is supplying the food for the employee, and let's say we had food poisoning break out amongst the employees who consume that food, that could be a work-related incident, as well as maybe some contaminants. The example that's given right in the regulations would be that of lead. If we get lead contaminating food and then it's ingested by employees, which leads to an illness down the road, that would be a work-related exposure. But the normal everyday people coming in, eating, drinking, and preparing food for their own personal consumption would not need to be recorded on the log. The fifth exemption here would be injury or illnesses that are solely the result of employees doing personal tasks at the work establishment outside of their assigned working hours. So if they're permitted to come on your company site and perform personal tasks, whatever those are, and it's not within their working hours, that, again, would not need to be recorded on your log. Next, personal grooming or self-medication or intentionally self-inflicted. If somebody happened to injure themselves performing grooming activities, maybe cut themselves while shaving, it would have to be a pretty nasty cut to get to the point where you need medical treatment. But if that were to be the case, that would not be a recordable injury. Same thing with self-medication, and intentionally self-inflicted injuries, again, would not go on the log. Now, if you have horseplay going on in the work environment, let's say you have one employee that comes up and, they kick another employee for whatever reason, and that results in injury. Say a knee is, blown out during that process. That would be a work-related injury that would need to go on the log. And in fact, if you were to ever call OSHA on an injury such as that and ask for their guidance, really their thought process is that we should have a work environment free of those types of activities, so that way we don't have these injuries. So that's why that would go on your log. We've got a couple more. Caused by a motor vehicle accident, and it occurs in your parking lot or access roads during the commute. You have employees pull into the parking lot in the morning, they park their car, they get out, and they get hit by another motor vehicle. That would not have to go on your OSHA logs. Depending on the state you're in, that very well may be a compensable injury under your workers' compensation programs, but it would not have to go on the OSHA log. And that brings up a good point that just because something is compensable under workers' compensation does not always mean it's recordable under the OSHA regulations, and the reverse can be said as well, depending on the case. Now, if you have a motor vehicle accident that takes place, you have a salesman that goes out and does routine sales calls, and they're involved in a motor vehicle accident out on a public roadway, and they are injured to a point where they need medical treatment, that would now need to be recorded on your log. This exemption really is specific to parking lots or access roads during the commute of your employees to and from the job. That does not this exception does not include things like slip and falls or trip and falls in the parking lot. It is specific to motor vehicle accidents. So if I park my car, I put one foot on the ground, I slip on ice, and I have a muscle pull that needs medical treatment, that would now need to be recorded on my log. Next exemption, common cold or flu. If you get exposed to the common cold or flu in the workplace and you go for medical treatment, that in and of itself would not be a work-related injury that needs to be recorded. However, there are some contagious diseases that may be work-related, things like tuberculosis, hepatitis A, other types of workplace exposures to those particular diseases would be work-related. And the last item is mental illness. And the exception is, I'm going to read it just as it's written, the illness is a mental illness. Mental illness will not be considered work-related unless the employee voluntarily provides the employer with an opinion from a physician or licensed healthcare professional with appropriate training and experience stating that the employee has a mental illness that is work-related. So not every mental illness is exempt, but in order for mental illness to be considered work-related under the OSHA regulations, there would need to be a voluntary disclosure by the employee of a medical opinion that states that that mental illness is work-related. A work-related stress claim or something along those lines may fall into being a recordable injury if you get that documentation from the employee. So now that we've talked a little bit about, the basic requirements, we've gone through some of the items where I've experienced some unclarity in the past, and we've talked about the exceptions. Now we're going to talk about what types of things do we actually have to record. So there's 5 general criteria for recording illnesses and injuries in the workplace. And those 5 are that injury or illness requires medical treatment beyond first aid, and we will talk about not so much what is medical treatment, but specifically what is first aid. OSHA clearly defines what is first aid. If it's not on that list, it's most likely medical treatment. Restricted work activity or job transfer. And really where this gets to be somewhat confusing from the employer's perspective is that these work restrictions may be imposed by the employer or a medical professional. And in either case, they could turn into a recordable injury. If I see somebody on our manufacturing floor that appears to be having pain in their hands and wrists, it would make sense for me to want to move that person out of that job before that exacerbates that injury even further and becomes a full-blown injury or illness. But if I were to take that person and put them on light duty or restricted duty where they are unable to perform the routine functions of their job, that would be a work-related injury that should be recorded on my log. Same thing would be said if that employee went to a doctor and a physician or other healthcare professional recommends that they follow some restrictions that prevent them from performing, again, their routine functions, that would be recordable. A routine function is defined as an activity that an employee would be involved in at least once per week. So if I'm a maintenance guy and at least once a week I need to climb ladders to go change out filters in an HVAC unit, but I have a work-related injury that has me sitting down at a desk doing light duty, that would be recordable because I am unable, either in my employer's opinion or a medical professional's opinion, I'm unable to climb that ladder. That would make that a work-related injury. It doesn't matter if those work restrictions are on for a year, a month, or a day. If those work restrictions are imposed, that would create a work-related injury. Days away from work. Again, this would be perhaps a doctor writes an employee out of work for a couple of days to rest. By being written out of work, that's an automatic item that needs to be recorded on your OSHA log. One of the common areas where I see some struggles with this particular item is, let's say you have an injury that takes place on a Friday, and you take your employee to a physician, and they get treatment, and it's all first aid, and everything's great from a medical treatment perspective, but the doctor writes on the paperwork, may return to work on Monday. Technically, what that doctor is saying is that employee cannot work on Saturday and Sunday. So we're going to talk a little bit later in this presentation about how we can interact with healthcare professionals before we have an incident in our workplace to help set ourselves up for success. But this is one of the reasons why medical escorting and having a positive relationship with your medical community is so important, because of little nuances like that. The doctor's intention is not necessarily to take the worker out of work for the weekend. They're trying to return them on their next available shift, and the employee tells them that next shift is Monday morning. So that's what the doctor writes. So this is really an area where you got to pay close attention and make sure you have good communication with both your employees, your escorts, if that's a practice that you use, as well as your medical professionals, to make sure that you're not putting something on your log for really a technicality when that wasn't the intention of the healthcare professional. Loss of consciousness. At any time, if an employee loses consciousness in the work environment due to an event or an exposure, that automatically has to be recorded, whether or not any other medical treatment is administered. Unfortunately, one of my facilities, we had an injury like this. It was at a safety event. At the beginning of the year, we shut down all of our factories worldwide and focused on safety, and we brought in a safety speaker. And during the course of this presentation, we had an employee that lost consciousness due to really the graphic nature of the injury that this individual's had sustained. And just became faint, lost consciousness, and that was one that we had to record on our log. It was the first day back in the year. It was not an injury that we wanted to take on our log, obviously, but at the end of the day, that demonstration in our workplace led that employee to lose consciousness, and therefore it had to be recorded. I mentioned it a minute ago, but in this particular case, I called our OSHA regional office, and I actually spoke to them specifically about this case. I encourage you to do that. If you've got questions on record keeping, you can call in anonymously if that's what you want to do. But if you ever have a thought process, you're not sure about it, reach out to the OSHA agency and get their interpretation. You may actually have to go through and issue a formal question and get a letter of interpretation in return. But oftentimes you can just call them up with a scenario and they will give you their guidance as to the best way to go about it. And I think that also comes into play if we back up a moment to the slide that we had the exceptions on a moment ago. And one of the exceptions that I'm speaking to is the voluntary participation in recreational activity. So another case that I'm familiar with, an employee walked outside to a smoking area. They were in the process of lighting a cigarette and burned their hand with one of those torch-type lighters, so a very significant burn right away. And as we started looking into this incident, our minds immediately started going to the voluntary participation in recreational activity. That has to be the sole cause, but in this case, if you look up the definition of a recreational activity, that would include doing things such as recreational drugs, of which nicotine is a recreational drug. So our thought process was we have an employee who's voluntarily participating in a recreational activity by going outside and enjoying their nicotine fix for the day. And we called the OSHA office and had a discussion with them at length about it, and they agreed with our thought process on that exception, so that was one that we did not end up including on the log. But again, I highly recommend that you really look through those exceptions, really figure out if your case one of those exceptions may apply to your case, and then if you're ever in doubt, reach out for some guidance. I know some folks are a little wary of calling the regional office, but in my experience, it's been nothing but positive, and I've always got a response to my questions. Maybe not that day, but they would follow up and give me an answer within a short period of time. So jumping back to the slide that we were just on, death, obviously that is an automatic recordable injury on your log, as well as a reportable injury. And hopefully some of the folks on this call, I ran into some of you guys at the NFC conference in San Diego a couple of weeks ago, and somebody asked specifically about the new reporting requirements for OSHA. You can see a link to that right on their homepage, osha.gov. In the past, things such as death, the hospitalization of 3 or more employees had automatic both recordable aspect to them, but also a reportable, where you actually had to call the OSHA office and report those. There have been some changes to that. They were just announced in early September, and they're being rolled out January 1st of 2015. A death would still require a report to OSHA, and that would include a heart attack in the workplace, things along those lines. But they've also reduced now the hospitalization requirements. It's no longer 3 or more employees. It is 1 person being hospitalized, which is being admitted to the hospital as an inpatient. If you have 1 person that has been admitted to a hospital within 30 days of the injury, you now have to call OSHA and report that, in addition to following the record-keeping requirements. They've also added on a statement about amputation. So if there's an amputation within the workplace, that also carries with it an automatic reporting to your local OSHA office. So we're not going to go too far down that path, but I encourage you to take a look at their website, read the new standard, figure out, number one, if your industry is exempt from those requirements, because some are. But if not, make sure you thoroughly understand what those reporting requirements are, so that way you're in compliance with those. The last category of injuries or illnesses that require recording on your OSHA log would be what they define as a significant injury or illness diagnosed by a physician or other licensed healthcare professional. And these things would include bone fractures, tooth fractures, rupturing of a eardrum, things like silicosis and those types of illnesses. Also, needle stick injuries in the healthcare field. If you were to have a puncture or a laceration from a needle or other sharp material that is in high likelihood to have been contaminated with bodily fluids or infectious diseases, those would also need to be recorded on the log. So you're going to have to take a quick look at the reference there. I put the reference right in the notes here, 1904.7B7, so you can take a look at some of the examples of those significant injuries or illnesses. But there is a list of things that, if they occur, they automatically have to go on an OSHA log. And the most common ones I see from that category are the broken or fractured teeth, the fractured bones, hearing loss, and ruptured eardrums. So those would all fall underneath this last category. And just to back up one more second from those reporting requirements we were speaking about a moment ago, the death, the hospitalization, the amputation, they also include loss of an eye. that would also require an automatic report to the OSHA office. So just to include that as well. So what is medical treatment? And I told you a moment ago we're not going to actually spend too much time on what is medical treatment. The next slide is going to cover what is first aid, which is really where we should be focusing our attention. But medical treatment includes managing and caring for a patient for the purpose of combating disease or disorder. And the following items are not considered medical treatments and are therefore not recordable. Visits to a doctor or a healthcare professional solely for observation or counseling, diagnostic procedures, x-rays, MRIs, that sort of thing. But also included with this would be the administration of prescription medications that are used solely for diagnostic purposes. The best example that comes to mind, and one that is written out in the regs, would be a prescription drug that's used to dilate the eye for diagnostic purposes. The administration of that medicine would not be considered medical treatment. You would not need to record that. Now, if that healthcare professional were to provide the drops that are used for anesthesia or to paralyze the eye so they can go in and remove a foreign body, that would be medical treatment. Same thing with a single dose of antibiotics. Under the old record-keeping requirements, oftentimes a single dose of prescription medication would not trigger recordability, but under the new regs, a one-time administration of a prescription drug would make that injury a recordable injury. And the last item that would not be considered medical treatment that we talked about is first aid. So instead of going through and defining every possible thing that could be medical treatment, OSHA defines for us what is first aid. And if the treatment is not on this list, you have to pretty much presume that it is medical treatment, and therefore you would have a recordable injury. But the forms of first aid that they specifically list are using non-prescription medications at non-prescription strength. So over-the-counter ibuprofen, things like that, following the over-the-counter dosage instructions would be first aid. However, if a doctor recommends using an over-the-counter drug at prescription strength, that would be medical treatment. And OSHA defines only a couple of prescription strengths for medication. So really your best resource for this is in the medical community, trying to figure out what exactly is the prescription strength of medications. The OSHA website does give you links. The handbook gives you links to some places that you can go and look for this information, but I will say it is fairly difficult to obtain. But if we're using non-prescription drugs at the regular over-the-counter dosage rates, that would be first aid and not recordable. Administering tetanus immunizations. You have somebody that has a laceration, they go to a healthcare professional, all they get is a tetanus booster. That in and of itself would not be recordable. One of the things I have seen in my experience, though, is often when you go in for a tetanus shot, they also will administer an antibiotic injection. That would trigger the recordability aspect of the injury. So, again, this is where things like medical escorting can help you out, but you really have to pay close attention to what an employee receives at the medical professional. If you were simply going to clean, flush, or soak the wound on the skin surface, that's first aid. Using wound coverings. That can be bandages, Band-Aids, gauze pads, Therastrips, butterfly bandages. Any of those things would be considered first aid. If you're going to use a wound closing device or whatever you want to call that, such as glue, surgical glues, stitches, sutures, staples, all of those would be considered medical treatment. And I guess the easiest way I've worked that out in my own mind is wound coverings are first aid, wound closures are medical treatment. If you're going to use hot or cold therapy, ice packs or heat packs, those would be considered first aid. Irrigation or a cotton swab to remove a foreign body in the eye. That foreign body, if it's embedded in the eye, that's automatically going to trigger the recordability aspect of it. But if it's something right on the surface of the eye that can be removed with a cotton swab or irrigation only, that would not be considered medical treatment, and that would be considered a first aid. They do have some other devices. If you were to use tweezers or you were to grind down a rust ring in the eye or use one of the little hooks that they use to pull materials out of the eye, all those things would fall under medical treatment and therefore be a recordable injury. Drilling of a fingernail or toenail to relieve pressure or draining of fluids from blisters, that's first aid. Using any totally non-rigid means of support, such as elastic bandages, wraps, non-rigid back belts. Most of the braces that you see handed out by healthcare professionals now usually have some sort of rigid means to them. Carpal tunnel brace is going to have the metal splint along the wrist. A knee injury typically has a hard plastic or metal support along the outside of the leg. If the support is meant to immobilize and there's any part of it that is rigid, that would fall under medical treatment. If you're going to use completely non-rigid means of support, not immobilization, but just solely to provide support, that would fall under first aid. If you're only using those immobilization devices temporarily while you're transporting somebody to a healthcare professional, that would fall under first aid. If we're going to put somebody on a backboard because they slipped and fell and they're complaining of neck pain, but yet we get them to the healthcare professional and no other medical treatment is needed because, really there wasn't a significant injury, the use of that backboard would be considered first aid. Same thing could be said for a sling if you had an arm injury. However, if that sling is now prescribed to immobilize the arm by a healthcare professional, we would have medical treatment and recordable injury. When we talk about foreign bodies or splinters in any part of the body other than the eye, you can use irrigation, tweezers, cotton swabs, or other simple means, and that would be considered first aid. So there are a few more things that are allowed if you're removing a foreign body from any part of the body other than the eye. But again, they have to be simple means such as the tweezers, the cotton swabs, and that sort of thing. If you're using an eye patch or finger guards, those would both fall under first aid. Using massages, even chiropractic treatment, if you only go in for one visit to the chiropractor, could be first aid. Physical therapy, if you're getting physical therapy at the time of your first appointment, could be first aid. If you have follow-up visits with a physical therapist or a chiropractor beyond that initial visit, that would fall under medical treatment and need to be recorded. And then the last item on here is drinking fluids to relieve heat stress. That would obviously fall under first aid. The next slide, just going to briefly cover a couple of items, common mistakes that we see on the OSHA log. And just for some information purposes, we're not going to go too in-depth into how to fill this out. But one of the first things that I've seen in audits and things like that around the U.S. is not stating how the injury occurred. In addition to the other information that you need to put on here, name and job title and that sort of thing, we need to state specifically how the injury occurred. We're not just going to put in there elbow tendonitis. It should be elbow tendonitis caused by whatever that event or exposure was. So actually provide a description of what took place. If you don't have a check mark in the right column, that could be a problem. So you can see you have death, days away from work, or the restricted duties, or other recordable cases. If you have an injury, let's say somebody broke a finger, but the doctor also recommended light duty or specific restrictions for work that prevented them from performing one or more of their routine functions, that check should go into the restricted duty box. If you have somebody that lost time due to maybe they slipped and fell and broke their ankle, but they lost 2 weeks of work, that checkbox should go in the days away from work column. If you have an incident that simply required medical treatment beyond first aid, most likely your checkbox is going to go into the other recordables, and you're going to check off the injury column on the right-hand side. So just make sure that you're paying attention to only having one checkbox in each one of those two groupings of items there. You also have to make sure that you keep an up-to-date record of the days away from work or the on-the-job transfer restricted duty. And we need to keep these logs updated and on premise for up to 5 years. So we really need to do a good job of making sure that we're following up on the life of an injury or illness and not simply putting it down at the time it happens and then never thinking about it again. Oftentimes, an injury may start as a first aid and have conservative treatment over the course of months, and then it leads into the point where medical treatment, maybe a surgery is required, and they're on restrictions. They come back to work, and perhaps we forget to keep counting those days of restricted duty for the entire time. We need to make sure that we're actively following up and engaged with the medical treatment process to ensure that we're accurately reflecting that information on the log. So I know that that's been a lot of information that I covered in a relatively short period of time. I want to make sure that I get through some of the tips that we have for helping to manage these incidents. But this is a topic that we cover during our what we call our base camp events through the Impro Learning Systems. So by all means, feel free to take a look at the webpage of Impro Learning System and see if you want to attend one of those events, and we can cover this more in depth even further. But I think some of the information on the next slides would be really important to the folks on the webinar. And what you see in front of you now is a copy of our Impro Safety Plan, that the required and fundamental pieces of our plan that are necessary for us to achieve the safety culture in our workplace and obtain our goal of zero injury. And you can see right up here towards the top half, things like 24-hour reporting and medical escorting play a key role in our plan. And the reason for that is, there's several reasons to it, but first and foremost, why we escort employees to a doctor. And we require medical escorting for all injuries that seek off-site treatment, usually by a supervisor or a plant manager. That's who would be an escort in our case. But first and foremost, we need to make sure that we're getting our employees the utmost care and medical follow-up. We've had a failure in our system that resulted in an injury, and now as an organization, we need to be there to care for our employee and ensure that they're getting the treatment that they need to get. That's first and foremost. We also need to make sure that we're there to help interact with the family and the employee or whoever may show up to that appointment. We also want to make sure that we use that time to begin our accident investigation if we can and minimize the potential for additional injury. If we're driving the employee to an appointment immediately following injury, we can begin obtaining information about what happened and communicate that back to the plant or to the office, and make sure that we're addressing those things before somebody else comes along and sustains an injury. We're also there to advise the employee and medical provider that transitional work or light-duty work is available. We're going to talk a little bit more about that in a moment. We want to obtain information that may help prevent similar accidents and injuries that's kind of along the same lines as minimizing the potential for additional injury. The more information we can get as soon as possible, the better position we are in to avoid a similar occurrence. Some other things that may be implemented: drug testing, if you require that as an employer. It's also an opportunity to look at things and see if there's a potential fraud issue going on right off the bat. And then the last item that we have is that we may have an ability to have an interaction with a doctor and prevent things from crossing the threshold of becoming recordable or losing time from work. And I'll talk a little bit more about that in a second. So when it comes to support and communication for the employee and actually for the healthcare professional, but we're going to be able to provide information to the treating facility on what happened, how it happened. We may be able to provide chemical information or process information they would find useful for their diagnosis and for their treatment. It helps facilitate communication, again, with the employee, his family, and the company, and we can help answer employees' questions while we're there at the doctor's office, get workers' compensation numbers generated quickly as possible, maybe even provide some approvals for medical treatment that might otherwise need to wait some time during workers' compensation processes. And then the escort really helps to communicate the company's full support of conservative treatment and immediate return to light duty or restricted duty work. As an employer, we will accommodate pretty much any and all restrictions that come forth from a medical professional. And that's both on our disability or non-work-related side of our business as well as the workers' compensation side of our business. Now, we talked a little bit earlier about that significant aggravation, so that can put us in a situation where we're more likely to have an OSHA recordable accident if we take somebody that's been out on a non-work-related injury and bring them back on restrictions. But we feel that if we have very clear and thorough communication with the employee, the doctor, supervision, we can ensure a safe work environment for somebody to come back to work. We also fully believe that by being back to work, that employee is going to be in a position where they can heal faster, heal better. They're going to be around a social environment that they're used to and really help them out with their recovery. It's definitely not to make things worse on the employee's end. We're able to keep their finances the way they typically are. We don't have to worry about loss of pay to workers' comp or any of those things. So I'm just waiting for the next slide to load up here. So after we've had an injury, another one of the key things that we need to make sure that we do is to have follow-up support with that employee and potentially their family as well. If they've been returned to work, that follow-up support should be daily through direct supervision, probably through some other folks in leadership as well, plant managers, EHS professionals, whoever that may be, swinging by, asking that person how they're doing, making sure that they're able to work within the restrictions, making sure they're not being asked to do things that they shouldn't be asked to do, but having that constant communication and generally just showing that we care. That's really, really important when it comes to care management. We, as an organization, also feel that it's our obligation to provide transportation to follow-up appointments if that's needed by the employee. Not everybody does that, I understand that, but we feel that that's our responsibility if we have a work-related injury that takes place. We would go so far as to provide rides to and from work if they are on medication that prohibits them from using heavy machinery or vehicles. So those are some of the things that we do to help support the employee. If somebody's out of work, we're going to do the same sort of thing. We're going to make sure we call their house. We're going to talk to them, figure out how they're doing, make sure that they know that they're missed, they're an essential part of our team, and keep that open dialogue and communication. I know I'm rushing through, but I want to leave some time for the questions I see popping up. So just one more slide here. And these are some tips for success that within MPRO we have found to be extremely beneficial. Thorough training for management and supervision on OSHA record keeping, on workers' comp practices, on how to escort employees to a doctor, what types of conversations to have, how your interaction should go, all those things. Training people how to make sure that our care management is implemented to the best of our abilities. We also train our employees on OSHA record keeping, our return to work programs, all those things. If an employee knows that a prescription medication would require us to record it on our log, and they are invested in our safety programs, they may be more likely to ask that medical professional for over-the-counter medication. So we provide this training to our employees, make sure that we communicate why we do what we do and what the regulations are so they can be a part of the process and be educated to help have these interactions with doctors. Many of you may know this, but if an employee or a patient in this case asks for something from a doctor, they're likely to get it. We as an employer are not. We may not even have the ability to speak directly to a doctor post-injury. So to have an employee that can be an advocate for those types of things is really important. And then the last item is, again, we may not always have the ability to speak with a medical professional post-injury, but to reach out to the doctors and medical community surrounding your locations, tell them or train them perhaps on OSHA record keeping, bring them on site, show them what you do and how you do it, inform them of your light duty or restricted duty practices. All these things can be done beforehand and really help you out after you have an injury. Sometimes that might be even setting up something like a golf tournament for doctors. I know that sounds kind of crazy, but if that's what you have to do to get them in the door, to have the conversation with them, those are some of the things that we've done. But really developing that strong relationship with the medical community is essential to helping minimize the cases that need to be recorded on the log. So I know I flew through some of that. I see a bunch of questions up on the side. So I guess with that, Carrie, if you want to help facilitate the questions.
Great. Thank you, Jonathan. Ladies and gentlemen, to join the question and answer session queue, press *1 on your telephone keypad. I will announce you by the state from which you are calling, then bring you into the conference. Please remember that if you have your phone on mute, to take it off of mute when you are selected to ask your question. To ask a question via the web presentation, go to the chat pod located in the lower left corner of your screen. Type your question in the text box, then click on the Send Message button. And we do have a question that came in right away, and from New Jersey. Please go ahead. Caller from New Jersey, please go ahead.
Yeah, I had an employee that he was on the job duty, and his job is basically to escort mechanics on the airport to fix aircraft. And what he did was that he went on a lunch break, and when he was washing his dish, he broke his dish and he cut his wrist. Now, we sent him to go seek medical attention, but workers' comp told us that they wouldn't be able to cover it because it wasn't really on the job. He had his break, which was a personal thing. So my question to you is, was that something that I had to report to OSHA? Is that something that I had to record for OSHA purposes?
I wouldn't look at it from the perspective that he was on break, because those things don't necessarily remove the recordability of it. But where I would fall would be under that exception we talked about a little while ago, eating, drinking, or preparing food or drink for personal consumption. I would consider preparing to also be the cleanup of that, just washing my plate after I eat a sandwich. I would consider that to be, preparation or cleanup of personal consumption. So I personally would feel that it fell underneath that exception and you would not need to record it. And again, that may not have any impact on the compensability of the claim. I'm not exactly sure of the New Jersey regs, to be honest with you, on workers' comp, but I don't think that that would be something I would put on the log, given the way you explained it.
Okay. All right. Thank you.
Mm-hmm.
Thank you. And we'll go back to our questions that have come in. What if the injured employee cannot identify where or when the injury occurred? Do I have to keep it in the OSHA log?
That responsibility really falls on us as the employer. We have to take a look at what happened. And if we see something that was likely to have caused or contributed to, again, it doesn't have to be the sole cause, but just one of the causes, that could be recordable. It's kind of hard to answer that given the unclarity around the question, but just because an employee can't identify where it occurred doesn't mean that it doesn't have to be recorded. Let's say they have something that gets in their eye, a fiber of some sort, even fiberglass. That exposure could be at home if you're working on remodeling the house, or perhaps you work in an industry where you have fibers like that in the workplace. Just because they don't remember that fiber specifically going into their eye, when it happened, how it happened. If we look at our processes and we think that we either caused or contributed to, that would have to be recorded. And OSHA really leaves that responsibility on us as the employer, although we can use the diagnosis from a medical professional. If a medical professional comes back and says, this is not work-related, then you can use that, and I would keep that documentation and not record it. But we really have to be careful even when you fall back on that exception, because if we go back to some of those injuries like walking along a level platform, maybe they already had arthritis going in their knees. So from a doctor's perspective or a workers' compensation perspective, maybe that arthritis is really the underlying cause of that injury. And walking along the floor in and of itself isn't what caused the entire event. So a doctor may say that's not work-related because of this underlying arthritic issue, although, as we discussed earlier, the walking across that floorway, the tripping or the slipping, we now have an event, we now need medical treatment beyond what we had before, that could fall under, that would fall as a recordable injury on the log. But if you truly have something where the employee doesn't know how it happened and you look at your process and you don't see a feasible way that injury could have been caused by your processes, then what I would do is have a thorough incident investigation documented on hand in case, OSHA were to show up at your door and begin asking questions. You'd be able to walk them through your thought process and at least have that documentation there to show that, hey, we looked at all aspects of this. We really don't see any way that this could have been caused by our work environment. The employee doesn't think that it necessarily happened here, and put yourself in the best situation that you can for that discussion.
Great, thank you. Our next question reads, what if you are staying at a friend's home who lives in the town you are traveling for work to? Would that be considered home office?
When you're traveling, if you check into a hotel, motel, or other temporary residence, you establish your home away from home. So those same types of exceptions that we talked about on travel would apply if you were staying at a friend's house. That would fall under a temporary residence, in my opinion. So that's the way I would look at it, and then just look at it to see if you've met the other criteria for recordability. But if they have now arrived at that house, they've kind of checked in, if you will, into their friend's home, you would follow the same exceptions that are listed under 1904.5B6 when it relates to the travel exceptions. Great,
thank you. And the next question, if an employee injures themselves and the doctor puts them on light duty, but our light duty is in the injured worker's job description, such as a mechanic cannot lift more than 40 pounds, but we have them do diagnostics until they are healed and given a prescription. That would not be a job transfer or such. I know it is a recordable, but not a lost time. Is that assumption correct?
Yeah, you have a recordable because they're not able to perform their routine functions, as we discussed, but they're at work, they're in the work environment, so there's no lost time. The restrictions, it doesn't matter if I'm doing my job more slowly or anything along those lines. The days away from work is what would be a lost time. If they're physically unable to come into the work environment, that's when you're going to have a lost time, not just because they're doing a different job. That would fall under job transfer or restricted duty, but it would not be classified as a lost time.
Great, thank you. If an employee is at lunch or break and trips and falls on property that the employer does not own, is this considered an OSHA recordable?
I would fall back to the definition of work environment. If I can make my way back through these slides real quick, I'll pull up that slide. But if they were required to be at that location as part of their employment, maybe I don't really know why that would be in this case since it's not employee-owned or employer-owned property. But if they were required to be there for any reason, that would be the work environment. And again, it would sound, based on the limited information we have in the question, that could be a recordable injury. Now, if they walk next door to McDonald's for lunch and they tripped and fell there, that would not be within the work environment, therefore not recordable. Same thing with maybe somebody has to walk off-site to a smoking location because as an employer, we do not allow smoking on our site. If they were walking off-site and while they're completely off our property, they sustain an injury, they're not in the work environment, and that is one of the criteria for having work-related injury. So that would not be recordable.
Great, thank you. The next question reads, what if an employee significantly aggravated an injury by performing a task that you instructed them not to do because you knew it could potentially aggravate their injury?
Unfortunately, that doesn't give you any exception under OSHA record keeping. That should be something that obviously you should manage and deal with from a disciplinary perspective. I mean, the way OSHA would look at it is just because you told them not to do it, you didn't prevent them from doing it, so therefore we put them in harm's way. Unless it somehow fell into the intentionally self-inflicted, which I think would be a pretty hard argument in the case the way it's laid out. You know, yes, they intentionally did something they were instructed not to, but they didn't intentionally hurt themselves. So I would think that would be recordable. It kind of goes along the same lines as the horseplay thing. If we have a culture within our work environment that these things are just simply not tolerated and people know they can't do them, we're in a much better situation. But in this case, obviously the ability for the person to do it was still there. They got hurt. You had an event or exposure. They were in the work environment, and they had medical treatment or something along those lines that crossed the threshold of recordability. That would be a recordable injury.
Great, thank you. And the next question, what about an accident while traveling for work in a work vehicle? Again, that one could get a little tricky. If you're commuting to or from the home away from home to the job site, would not be recordable. If, again, maybe you're driving on a construction site, that's actually not a good example because that would be an access road perhaps. But let's say I'm a salesman out doing calls and I get in a motor vehicle accident, that would be a recordable injury. So if you're in a work vehicle and you're even traveling from, say, the airport to the hotel, that's still going to be a recordable injury because we have not established our home away from home yet, and it's not going to be part of our commute. So you really have to look at what they were doing when they were in the work environment, where they were going. Again, if they were doing personal tasks that took them on a detour outside of a reasonably direct route, you might meet that exception as well. But you really have to look at what they were doing and why in order to fully answer that question. Okay, thank you. And if someone is self-medicating and they get injured, is the injury recordable?
That comes directly out of the exceptions, the same exception when we talked about voluntary, that's not voluntary participation, but that's the one where we talked about the personal grooming. So self-medication for a non-work-related condition would not be a recordable injury. If they somehow overdose on their prescription, again, for a non-work-related issue, that would not be a work-related injury and therefore not recordable. If they are, I'm not sure if that question may be that they're self-medicating and that medication perhaps, causes them to be drowsy or something along those lines, and that causes an injury. I'm not sure if that's where that question is going, but that could then fall under a recordable injury. you really have to look at all the details on it to be sure. But if somebody were to be under the influence of a prescription drug or non-prescription drug and they get hurt, that could still fall on our OSHA logs depending on where it happened, how it happened, and what the treatment was.
Thank you. Next question, similar to one that we've had before. Is it a recordable if the employee, is traveling from the site, job is completed, but gets into a motor vehicle accident before getting home? So the job is completed, they're leaving the site, and they get into an accident on their way home.
If I were looking at that, I would have to be looking at what type of job site it is. If, let's say I'm in like a field service type of position and I go to a different customer site every day, that wouldn't be part of my commute. That drive would be, a work-related travel. So that could be recordable. Now, if this is the same job site they go to each and every day, and they were to get injured during that commute, it would not be going from home to the job site. But if it's not a fixed work site that you go to pretty much each and every day, that still could be a recordable injury because it's not part of the commute. That was, again, a little bit difficult to answer, but I'm leaning more towards recording it because, they don't have that home base that they go to each and every day. It's not part of the commute to and from the job. It's travel for work-related purposes to get to a customer site. So I would think it would be recordable.
Great, thank you. We have gone over our time, and there are still a lot of questions in the queue, so our speaker will do his best to get back to you if possible, but that is all the time we have for today. Jonathan, if you could just give us a wrap-up of closing comments.
Again, thanks for joining us today. I'm really happy to be able to share some of this information with you, and I know that it's a lot of information in a very short period of time. Again, if you check out our website, nprolearningsystem.com or nprolearning.com, you'll be able to take a look at our events. One other nice thing that I think I'll mention is that we offer a care management book, which is a really quick reference guide that you can take with you on medical appointments or medical escorting. It goes through some of the high-level items on OSHA record keeping, as well as some of the tips and tricks we talked about today, how to deal with the medical professionals, the types of communication to have with the employees. But this topic really is a complicated topic. It may seem pretty cut and dry when you look at the regs, but you really have to do your due diligence, read up on things beforehand, and really dig into it and try to interpret the regulations the best that you can. So if you'd like some more help with that, by all means, check out our website and see if we can't help you through one of our upcoming events. And I will do my best to get back to some of these questions I see on here. But thanks again for joining us.
Great. Thank you so much. Ladies and gentlemen, following the conference, you will receive an email. It will contain a link to a brief evaluation form. In an effort to make each webinar more beneficial to our customers, we would appreciate your input. BLR and NPRO would like to thank you for joining us today. This concludes our program. Thank you.